So today we have Marcus White. He's an international speaker for Invisalign and iTero. He's a diamond level provider and has completed over 1,000 cases. He's recognized as one of the most prominent opinion leaders for our digital dentistry and intraoral scanning. His fully private practice in the heart of Yorkshire has seen transformative revenue growth and clinical efficiencies through committing to digital innovation. Marcus has built his own on-site digital lab that provides every dental and implant restoration needed for his thriving practice and some key national customers. Marcus now runs Digital Growth Program, a monthly webinar series for driven dentists all over the world, wishing to emulate his techniques and digital workflows. Today, Marcus will aim to educate and inspire dentists to become part of the digital generation and elevate the dentistry they provide for their patients. Dr. Marcus, please.
Thanks for the intro there, Terence. Much appreciated, and it's an absolute honour to be here today. As you can see from the title of the screen, we aim to get a lot of new dentists on board to join the digital generation and really present a very compelling argument why committing to digital simply makes you a better dentist and allows you to deliver better treatment to your patients. And maybe that's not been said with as much confidence as that in before. It was a sort of a question mark about it would improve. I'm going to categorically show today that committing to iTero and intraoral scanning benefits patients and benefits you. So just going to get a little disclaimer out of the way. For those of you who can read fast, do that, but I will summarize. Essentially, it just states that the views that you're going to hear today are mine and my own, and therefore please make your own judgments before emulating any of them, and please be wary of your own jurisdiction's laws and regulations. It states not to take any recordings or photography other than at the end where I will show my contact details. And if you then want to screenshot that, I would welcome you to do that so you can get in touch with any questions thereafter. So that's the main bit of the disclaimer. So a very brief introduction because we've got an awful lot to get through. I always try and cram as much content as I can into the 60 minutes I have. So a mere 6 years ago, and it's funny when I wrote this, is 6 years a long time or a short time to get to where I have got in digital? And I'd say it's quite a short time, really. But yet you'll see what we have achieved in that time. So 6 years ago, we bought our first intraoral scanner. Today, we operate 5 iTero elements in a fully digital, interconnected practice. We have built a digital lab that designs and fabricates every restoration we fit. I am part of the digital generation, and I am better through digital. Hi everyone, I believe I am a member of the digital generation. I remember many generations that have come before. The amalgam generation, the composite generation, the implant generation, all defined by an advent that improved how they could deliver dentistry. Okay, I now put digital central to everything I do at this practice. Whether it's diagnosis in an examination, whether it's improved communication at my consults, whether it's the way we digitally design and execute our orthodontics through Invisalign, whether it's how we digitally design and execute our restorative through digitally designed outcomes and more accurate restorations. I know that digital enhances what I do, and at the Align UK Forum, I'm going to demonstrate how digital can change how you perform dentistry and how digital makes you better. I look forward to seeing you. So what I'm saying there is that's where I think all modern young dentists should aspire to be. That's the next level. Okay, we've like I said in there, we've learned about composite. We've done the implant thing. This is where you will raise your game through digital. I'm going to show you a little video here that gives you a real feel of how digital runs through our practice. It's just a normal Friday at the courtyard. The picture we hope to paint is how the digital tech we have literally acts like a seam through all of our treatments, how it's helpful to inform patients on different options so that they don't just have to imagine an outcome, but they see it on screen. then they can have real consent about which direction they choose to go.
My name is Eve. I will be seeing a new patient, Ashley, today for her initial consultation.
I'd like to change the shape of some of my teeth and get them a bit whiter.
And we're going to take some digital scans and we're just going to have a look at her teeth together and come up with some solutions to improve her smile.
And really what we're trying to show is how easy digital makes what we do, how efficient it makes us. If you do not keep up with this technology as a dentist, then you're leaving your patients in a worse position, and you're probably leaving yourself in a worse position. So if we just look at this particular site here, now the digital design is going to help guide our treatment, the amount of gum line that we need to increase to get these teeth over. Black and white words are no longer enough to record that you gave patient options, because how could they visualize those options? How could they know what they were going to look like and how you were going to deliver it? We tried once when we first built our digital lab to be only digital and not have any humans, and could we just mill a final veneer and place it, and we found we couldn't. So no, we need Bernard. He's got 35 years of experience in layering pure artistry onto digital design so that you get that perfect blend. You replicate what the patient's approved, but then you add a finish that's bespoke.
Yeah, it's mixing the new technology in many respects with the old. It's always evolving, and you have to go with the changes. But digital is certainly the way forward. I mean, for the dentists, it's great because they're only taking scans and not having to take impressions like they used to in the olden days.
Just think of the data that we're taking here that's over and above that which an impression can take. So, as well as the increased accuracy, we're effectively filming every key step of the dental process as a record. At the centre of it all is a person who's got a backstory, who's got a reason they're here in the first place, and that, I hope, will come part of the picture, and you see the impact that all of these things has on the individual.
I was really conscious of how my teeth looked. My partner had his done here and they're absolutely wonderful. So he retired and I got mine done.
Can you see how we've opened up the bite? So on the before, had this really deep bite. I didn't see any of the lower teeth whatsoever.
I absolutely love them. But I have to learn how to smile properly now. Love them.
Everyone asks, is digital the future? No, it's not. It's the present. It's not something that's coming. It's not something that's yet to be invented. It's already here. It's in that corner. And we live and breathe it in every aspect of treatment we do. So if you're not currently doing it, then you're being left behind. You're being left in the past. So you'll see there's two very big points we make there. The one is the final point, that the longer you wait to make that decision, the more you're being left behind. And once again, that's not an opinion, that's a statement of fact. The longer you wait to learn how to become a digital dentist, the more you're being left behind. All right. The second thing is that I don't hover too much on in this presentation, but I love it as an aspect, is that every time you take a scan, whether it's at patient presentation, prep, Invisalign, anything whatsoever, you accidentally record something, okay? You leave a digital footprint that protects you from litigation. It keeps a very good clinical record, far superior than you could ever record in black and white words. And that's another added benefit that doesn't get enough limelight, but I want to make it clear. So, firstly, we're going to look at what might be any dentist's primary justification to becoming a digital dentist. Does it need to be financial? We're going to look at that, okay? What I want you to consider is that everything digital has ever done, whether it's your iPhone, whether it's a Tesla, whether it's an email, okay, it eliminates, okay? It eliminates materials, processes, and wasted time. And it always brings through efficiencies. That is once again no longer up for discussion. That's got too much track record behind it that shows that digital always wins. All right, so you'll be eliminating things in a good way through digitization. So we only need one good reason. And when I started, it was accuracy. Okay, 6 years ago, it was the accuracy question. I did also formulate a business case to make sure that that was sensible, but really our first was accuracy. But before that, I'll show you the many number of improvements and benefits that digital brings you. Okay, efficiency and accuracy we've covered there. It improves your skills, largely through improved visualization of what you're actually doing. And in addition, the ability to 360-degree review what you're doing, and we'll look into that later. Anything that increases efficiency increases profits. And I'll show you how through the consultation with intraoral scanning, you will increase revenue because we did. Record keeping I've touched upon there, and the fact that that will ensure that anybody ever looking at how you carry yourself in your profession shows you, it looks like you take your job seriously. Okay, and as such, it will hopefully reduce or avoid litigation because you have records of every single step of the process, every single part of that consent. We're going to talk about visual digital consent today, and the fact that if you are presenting treatment to a patient, it should always now be in a visual format so they know where you're planning to take treatment and that they know you've planned it with enough detail. Okay, so digital design we're going to cover. We're going to showcase that in committing to all of these things, it cannot fail but take you to another level, okay? One that you cannot achieve without digital. As a byproduct of all of this, do you think your patients are going to talk about you and the technology in the corner of your room that you use and place central to every aspect of their care? Of course they do. Even in a checkup, you know, we now carry out a scan every single examination, and I effectively examine their dentition on the screen because it's larger and more detailed than it is through my eyeballs. Okay, so you know that process alone shows the patients how seriously you take their care, and that's going to create word of mouth, and that's going to bring new patients. And finally, the upskilling of staff. Our treatment coordinators at our practice see every new consultation for a scan before I ever meet them. Okay, and they talk about treatment options with them. And that elevates them and their confidence and their job satisfaction. So let's begin with accuracy, which in restorative dentistry was the reason that I got our first scanner. Okay, this is the current analog version of our restorative pathway. And you look at it and you can see at every stage where an error could easily be introduced, whether it's the impression taking, the model casting, the trimming of the die, attrition on the neighboring teeth. Any number of things could happen to make sure to decrease the accuracy of your restoration and introduce errors, okay? Think about how many human processes have gone just to create the model, not even when the restoration starts to get made, but just to create this model. Think about all the processes to get the record to the lab in the first place. You've got an analog impression, it needs sterilization, it needs putting in a bag, it needs posting, it needs delivering. With an iTero, you just push a button. Okay, so on the digital side of things, this is what's created, a 3D printed model, and then a restoration is made for that. So let's look at that process. This is what a milled restoration looks like on a 3D printed die. And what I'm saying here is the same data, the same scan data goes off to the printer, goes off to the mill, and ultimately is fitted. So it's no surprise that that restoration is accurate because no data has changed hands, okay? Here's a 3D printer. At our practice, we have a few Formlabs and an Xdent, but we use Formlabs for a number of years before getting something a little bit quicker. This is a mill. Milling Emax, we now use zirconia across all our restorations because of the improved strength, accuracy, aesthetics, and the margin can be finer, but Emax is still wonderful. And what I'm keep trying to show you here is that no human error can be introduced at this stage because no humans touched it, all right? So here is the first time a human touches it. It's you know, the die has not been modified. It's still on the struts from the printer. The milled restoration is still on the block straight from the mill, and it fits like a dream, okay? And once again, why wouldn't it? So, you know, we get an exceptional fit every time, and we get digital precision, all right? So let me show you what digital precision looks like. For those of you paying attention will notice that in the top left, I talk about zero retraction cord, okay? I haven't got time to cover that today, but we fitted over 5,000 anterior porcelain units with zero retraction cord. A scanner scans what it sees, okay? So if you can see a margin, so can the scanner. You don't need to manipulate it or modify it or retract it in any particularly strange way. If the scanner can see the margin, then it will pick it up, okay? So the financial argument, what financial motivation is there? Well, I am a track record, a case study in digital. So I have measured what digital did for us in our practice. And one of the most startling pieces of data was that from when we got our first iTero in 2017, not our first ever scanner, but our first iTero, so we were already familiar with digital. But what iTero brought to the table was that dramatic color screen, okay, that patients could engage with. And we started using the scanner in a consultation setting. And we found that in the first 12 months from our first iTero that we had 33% growth, okay? Globally or in the UK, you know, a normal growth was sort of 1.8%. So how could a practice generate 33%? Over the 5 years that we worked with digital at that time, we doubled revenue, okay? So both of those are really good motivators to why you should become part of the digital generation. Okay, so I'm going to show you how the digital consultation was so dramatic, okay? So for over 200 years, we've seen teeth one at a time in the reflection of a dental mirror. Now, for the first time, we see the dental system as a whole. So it gives us a new perspective, okay? We're not looking at a single tooth at a time. We're looking at an arch of teeth, their interactions, their neighboring restorations, the occlusion, so many things immediately become apparent because we're looking at it in a very different way. And guess who else is? The patient, okay? So the touchscreen interface allows us to demonstrate our observations to the patient in a way they understand. For the first time, they see their own problems in color on screen. There is no hiding from it. In addition, there is no reliance on trusting the dentist. They trust what they see. So what I mean by that is for 200 years, we've needed a patient to trust our views and observations because they couldn't really relate to them. If we show a set of bite wings on screen and say you've got a cavity, it just looks like black and white, it looks like a broken television to them, okay? But to us, we see stuff. So if we're telling a patient that on X-ray we see some infection that requires a root treatment, they have to trust that. And they have to trust that the treatment we're advising will fix that. With the scans, it's no longer like that. They see the problems, the fractures, the old restorations, the missing teeth, and therefore they buy into whatever solutions we're offering them. So it's just a couple of early carious lesions there, but yet the patient still sees those brown marks. They understand what we're about to propose for them. A little bit of calculus on the lower anteriors that the patient can see. So whilst this is not, £1,000 treatment plan, it's a very easy bit of treatment for the patient to understand and engage in. So what if we look at more complex treatments? How would that level of visualization help us then? Well, this patient came in while we were still trialing the iTero, or at least in the very early weeks, and she requested some new veneers because when she looks in the mirror and smiles, she just sees her front teeth, okay? And with the iTero, it was very easy to showcase to her that she needs a lot more than just new veneers because she doesn't own any back teeth, okay? So what I found was it was so much simpler to get across these concepts to patients, and the treatment plan almost writes itself. In this case, the patient needed full arch upper implants because these teeth were periodontally involved. And when we move over to a 3D view, again, even the periodontal health or lack of it is very apparent to both us and the patient. So these conversations go a lot more smoothly. Like I said, if all you had was a patient mirror to show the patient the issues, you couldn't show them the missing back teeth, and it wouldn't click right. So these kind of things make complex treatment planning much simpler. Here we can see how tired the lowers are, and even though it was the uppers that she came for, she very quickly understood that we would have a mismatch aesthetically and functionally if we didn't do something to address these two. All right. And then we're able to deliver the treatment, and I'm going to show you how later. That is, quite amazing. So digital elevates our technical skills as well. Here's another case, just the same. This patient came in and said, I have a broken tooth, and pointed at this one here and said, can you give me a new tooth? And I said, you have bigger problems than that, sir. And we showed him the scans, and just like before, we went through a little 3D view, and you'll see how stark the challenges he faced are, and how therefore he believed in the solutions we suggested. In this case, we managed to keep some of the teeth. Surprisingly, we did a lot of soft tissue and crown lengthening, and I think it was maybe 3 implants we used, and the rest is his own dentition. And once again, we delivered a very dramatic result for him that it's very impressive. So, digital design. Everyone's been talking about digital smile design for a long time, but yeah, I truly believe not many people actually understand it. For us, digital design underpins everything we do, okay? So we do not talk about treatment with a patient until we've shown them a visual of where we're intending to take them. So the cases you just saw there were the same. And for example, I wouldn't know how to treatment plan that complex, broken down dentition without my technicians drawing out what is possible, okay? So it has to start there. And what I'm saying is that tool is so valuable because you as a dentist can't possibly imagine an outcome just by looking at a set of models. And what you'll see is how much more communication and back and forth you can do with a digital design as opposed to an analog wax up, which you just get in a box and hope is all right. So when a digital design comes to me from my designers, I'll, like I say, I might have some views myself, and it will go back with some amendments. Then we'll show it to the patient. They can have some amendments. And then finally, when we're happy, we print a 3D printed model and a stent that guides the dental, the preparation of the teeth or the placement of the implants. So everything starts with a digital design. And what you're seeing here is how closely the digital design we showed them, literally not at the consultation, but very shortly after, we then commit to delivering in the final outcome, okay? And when I put those two together, you'll see that that's what I call a 360-degree quality control, all right? So let me show you what a digital design process looks like, because it's complex and goes to show the level of work that goes into this at the technician side. So this is important. So from a full face photo of the patient, a full face photo of them smiling replaces a face bow, okay? Because from that view, we can identify the 3 key lines: midline, occlusal plane, and verticality. And the model will be placed on the screen with these grid lines in that plane, all right? So any issues with verticality or occlusal plane are therefore noted so that the new design can correct that. So with digital, with an iTero and a good photo, you don't need face bows anymore because the same information is being translated in different ways, all right? So once that's on screen, then the technician will remove the facial aspects of the dentition and bring in library teeth that are obviously golden proportion designed, and there's some very famous libraries out there. So, our start point is very much a classic tooth shape, and they're pulled into the right shape. And then we do some micro positional alignment. So we see if we want to do some rotations and what have you. And then we review it back on the grid and make sure that we've got all that symmetry as we want it. And then we have the final design, okay? And then as before, that's presented to the patient in a bit of a before and after, that, they're presenting dentition, their digital design, and that's enough in our experience to allow them to understand the changes that we're proposing, all right? So digital visual consent is the following. It's consenting patients to all options digitally where possible. It's not relying on their imagination or trust. Provide them with visuals, all right? So whether it's orthodontic or restorative, you provide digital or visual consent. In orthodontics, guess what? It's called the Invisalign outcome simulation. And before that, it's the ClinCheck. So Invisalign were the pioneers of digital consent because they understood that despite the hundreds of years of traditional ortho that had gone before, that it wasn't appropriate to start moving teeth until a patient knew where you were going to move them to, and so did you. Okay, and I think that's a really important landmark for Align, that they developed this system that, and they've continued to develop that system that says, no, we will not start moving teeth until the dentist and the patient agree where that's going. And that's what Christian Coachman says, a promise to never carry out dentistry until you've completed it in the digital world first. A beautiful concept. So what does it look like and how is it helpful? So when we started using the Invisalign outcome simulation, it's designed as a sales tool, but it's more than that actually, okay? Because a patient comes in like this, and until I run that simulation, I don't know how to treat them, and the patient doesn't know what treatment they'd like. So this patient comes in, you can see some rotations, you can see some misalignment. We run the outcome simulation, and I think that's a nice outcome. Patient's there, and she's in the room. She goes, surprisingly to me, I don't like it. And I was like, okay. And then when you scrutinize it and through conversation, you go, okay, there are some black triangles. And if you look at the actual color visuals, let me see if they come. No, we'll see them at the end. But the teeth are a little tired, okay? So therefore, orthodontics alone won't deliver the smile and the aesthetics that she has in her mind, okay? So if we're not going to do orthodontics, then it's a restorative or a cosmetic veneer approach we're considering. Well, I'm not going to just embark on that, am I? No, of course, we're going to present a visual design as well. So we take the scans, we design it up, and sure enough, that is more what the patient was looking for. So now the patient's been completely consented in both formats and has picked the one that is right for her. And that's far more powerful than just having a stock template in your notes that's saying orthodontic options considered, patient wants veneers, all right? This is true consent. There's the case. So you can see it when you look at the top that, yeah, there's some recession, some black triangles, some early lesions, and the enamel's a little thin. And yes, they wouldn't have, there would have been limitations in the aesthetic she was looking for. And then from us, we delivered the outcome she was looking for. And when you compare it side by side with the design that we promised her, you'll see that how accurate it really is. Like every line angle that we delivered is the same as it was in that visual. And that's called quality control, all right? And that's how it improves how you deliver every aspect. Were your preps guided by the stent? And we're going to show you later. Yes, they were. Were the restorations the same as the temporaries you delivered? Yes, they were, etc. Okay. So what if we get a case that, like the horribly complex one earlier, I don't even know if we can carry it out? Well, digital design comes to the rescue again. So before you touch a tooth with your drill, before you commit to a case at all, you're going to run it through a digital design and see if it's possible. So this was a young girl in her 20s, would you believe, who had, it was a very, very heavy bruxist and needed some restorative work. But where were we going to fit the teeth? Well, we needed to open up the bite. Let's use digital design to see what's possible. So when this case is done on a digital design platform, a virtual occlusal articulator is lifted, and the incisal pin is lifted, and a completely new occlusion is designed at the new height, which then in the processes I'll show you, we test out in the patient so that by the time we deliver the definitive restorations, we have scanned approved patient data. I get very excited. So that's then how we went on to deliver it. And again, it's a replica of the design that we discussed at the outset. What about implants? The same. Now, I'm not talking about surgical guides here. They are fantastic, but what I'm talking about is digitally designed restorative outcomes, all right? So here, once again, a digital design is added to effectively an edentulous ridge that then we use to, well, I'll show you. We then make a model, okay? We print that design off. We do a vacuum formed stent. That stent does two things. It helps confirm that the implants we place are in the restorative envelope, the restorative window, and it also allows us to deliver our temporaries. So we put a self-cure acrylic inside that stent as our immediate load full arch restoration. And there it is, okay? So once that's in, 6 weeks later, we scan it, and then we replicate it in a PMMA. And what this slide shows is how comparing the initial visual that we presented the patient with where she was 10 weeks later is once again exactly the same. And can we scan full arch implants? Yes, we can. We've done over 100 cases with iTero now. And each time we scan the implant position and the chair and the temps we gave her at fit, we get 100%, and I'll repeat that, 100% fit statistics from the next stage. So when we start with the design, we place them at the surgical appointment. When we scan the implant, which I'm going to show you here, there has been no instance where we've not had a 100% fit record. So this is scanning 6 implants on a full arch case. Takes 32 seconds to do. And the accuracy. Now, in the early days, people were fearful of testing these things out, but we have our own lab. There was, we have our own printers, and we mill our own restoration. So there was no reason not to explore the accuracy question on full arch. And in our practice, it's no longer up for discussion because they fit every time. And once again, when you're able to execute on your vision, your promise, it gives you great confidence. And workflows underpin all this, okay? And you'll see the same flows being repeated. Digital design, delivery of the temps, scan of the temps, and then quality control of the restorations, okay? So many benefits, guys. So that's our midpoint. So many benefits. So where do you start? Wouldn't it be nice if there was a single workflow you could use for every single piece of dentistry that put digital central to what you do? All right. Guess what? Start with a scan. It couldn't be simpler. Okay. Whatever you're doing, start with a scan. So if it's a consultation, you can start with a scan. You may not know, you should not know at that point how the treatment's going to go, but digital will help you. Okay. So if it becomes apparent that an orthodontic pathway is what's going to happen, you're going to carry out an Invisalign outcome simulation. We do them as standard to rule it out. We do them for patients who turned up to during our practice. We've had a lot of patients take up Invisalign in that way. So it's your obligation to show what digital can show to the patient. What if you want to go restorative? Then the same scan then goes to your digital technician and you ask for a digitally designed outcome, which is our term and is different to digital smile design. For me, digital smile design is a marketing tool, and it's something that shows the patient a very beautiful smile laid on a 2D image that will motivate the patient. And we do that as well, but it's not the same as this. This is a promise, okay? This is technically and practically what you will deliver to the patient, and as such, it's called a digitally designed outcome. What if after all that, the patient just wants whitening? Fine. The scans go off to a 3D printer, you print some models and whitening trays. So whatever the start point, and you don't know the outcome at this point, you start with a scan. Let's go through a few more of the detailed breakdowns of those processes. So what if you start at the consult with a scan and then it's a composite bonding case? Well, you have your digitally designed outcome, the patient approves it, okay, you produce visuals, you therefore obtain visual consent, you then print 3D printed models, you develop a clear matrix so that you can carry out injection molding flowable composite technique, and you've delivered a predictable outcome that matches the visual consent obtained. What about implants? Guess what? You start with a digitally designed outcome. You produce visuals. You obtain visual consent. You combine the STL and the CBC to produce a surgical guide, okay? But you also use a template to deliver the temporaries if you're doing immediate loading. So you have predictable surgery and predictable initial temporaries. And then finally, you deliver a predictable outcome that matches the visual consent. So let's go a little deeper and give you some of the secrets to our universal restorative workflow. The tools, okay? You'll see through repetition how simple this process is. You need the following 4 things: iTero scans, a digitally designed outcome, or DDO, for those who want to get familiar with the terminology. You then create some 3D printed models and a vacuum formed stent. So once you have a scanner, to get the additional tools is very, very low cost, okay? So you're requesting a design, you're printing the design, and you're getting a vacuum formed stent around it. And they're all the things you need to carry out the kind of cases we're going to talk about next. So visually, iTero scans, digitally designed outcome, 3D printed model, stent. Okay, so that's just like a whitening tray. By the way, I think our blanks are just slightly in the middle. So I believe it's 0.6 mil blank. So it's slightly thicker than a whitening tray, but not quite an S6. That's what we use for our stents. And it has enough rigidity, but yet it picks up enough detail to allow us to do what we want to do. So what do we want to do? The process is very simple. A patient presents, in this case, a bruxism case, okay? Guess what? Models stent. Now, that stent acts like a prep guide, and you're going to see how beautifully and simply it helps you carry out your preparation, all right? So once you've removed undercut, that's all we've done. So these are sliced prep veneers with a vertical margin, okay? So there is little to zero preparation at the gingival margin and facial aspect. And when you're looking at this, you probably won't believe me, but later I have science that will prove it, okay? But all we've done is remove convexity, okay? Because I need the veneer to slide over the tooth. So I need to remove undercuts interproximally and convexity facially and leave enough room for my restoration. But the first thing is just about removing convexity. Have I left enough room for my restoration? I can't tell by looking at it. And I don't want to cut up pieces of putty and indexes to have a look. I'd like to have a clear window that can show me in a 3D format if I've left enough room for my restoration. So I use the stent, I seat the stent, and I can see very clearly in all formats that I've done the minimum amount of preparation to allow restoration to slide over it, and I've left ample room in this case for the restorations that we have designed and the patient's approved, okay? Now I'm going to use that same stent to deliver my temporaries. Just relax your jaw a little bit. Stay there a bit. Come here, top down. Can you see what you're doing? Just maybe perpendicular. That's the view you want. And then after 3 minutes, you remove the stent. Grab it. Just like that. Set it off already. Come on. Beautiful. Then hop up and then get away. A little bit of trimming into proximally and gingivally.
Yeah.
And you get that, okay? So now the patient is in temps. Nothing particularly new about that. But what we now do is we check our 3 lines, verticality, occlusal plane, and midline. And we also assess the occlusion and adjust it, okay? So what we have now is the best articulator in the world, the patient's head, all right? So we get the patient to do some anterior and lateral excursions, and we mark up in blue and we adjust until it looks comfortable. And then we scan the temps, okay? Because when we scan the temps, we've recorded that data that we've tested in the patient, and we deliver that to our lab to be replicated without variation or digression in any way. So that what we then achieve is that we've taken patient-approved data in vivo and replicated it in the final restoration, okay? That's a very, very profound thing that digital lets us do. So here's where we're assessing the aesthetic planes, that they're all correct, and then we've replicated them to the micron in the definitive restoration, okay? And then that's then fitted, all right? So big wear case, minimal prep, additive, largely speaking. Now let's cut into that in a minute. So no one would argue that that makes us better through digital, all right? But let's take it one step further. Let's have a look at our prep, okay? Let's see how much we actually did remove, and if it was as minimal as we would have liked it. How do we do that? Well, we take the prep model and the pre-op model and we scan it into iTero in the time-lapse function, all right? And then by comparing them, by overlaying and superimposing those, you get this guide up that tells me what we've done, and it's really quite fascinating. Hi guys, so here we are looking at the bruxism case we've been reviewing. So, as you know, if we look at the pre-op, very worn incisally, cervically everything's okay. So the prep has really just been interproximal to allow the veneer to slide over and to also modify the widths as per our principles. So what's nice is the key here lets me know that categorically we've done zero prep to the facial aspects of those centrals, and only when we go into proximally have we extended into circa 1 to 1.2 mil of prep. So it's fascinating. So the yellow is 0.5 of a millimeter to 0.7. So anywhere that hasn't got any color at all has less than half of a millimeter of reduction. Okay. So on the majority of that canine, on the majority of that central, we're under half a millimeter, which for me is fascinating, and using science to show that if you understand the principles, we're using zirconia as the restoration here, so we're making sure that as much of it is very fine. Maximum outcome, minimal intervention, which, by the way, is a webinar we did a few weeks ago. So you can look it out if you want more detail as to these processes. So what if we have a more challenging case like before, where it's hard for you to even understand how you're going to plan it out? Well, once again, digital design comes to the rescue. So how, this case presents, there are so many ways we could look to restore this. Do we need an implant? Do we need orthodontics? It's hard to see in this image, but he's got a crossbite on the right-hand side. So it's very difficult to think how to do it. So we know that restorative is going to play a part. So that was our, first line of thinking. So we sent it off for design, and the design that came back was this. Okay. So what's happening here, it's hard to see, but it's basically bridged that gap from the upper left 2 to the upper right 1 in a very convincing way. The midline's bang on, and when you see the case borne out, you'll see how it was a perfect design. And on the patient's right, we've tipped the premolar and molar over the bite to really redesign his occlusion. But I would not have had the confidence of doing that had we not seen it on screen, seen it on models, okay? Neither would the patient. So there we go. The old crown's off, minimal prep on the others. On the upper right, again, just removing the convexity from the tooth to allow the restoration to slide over. A little bit of soft tissue work. I can't go into soft tissue margin elevation at this stage, but tissue exposure is something we can cover in greater detail, and how we avoid the need for retraction cord. You assess with a prep guide, and once again see that you've left 1.2 mil as a minimum, and here we've got ample for the additive technique. Delivery of the temps as before. Some trimming, you can see the occlusion is beautiful, and we would assess that in lateral and posterior excursions, and as described, then we scan that so that the definitive restorations are replicated. All right, and midline, beautiful. Occlusal plane, beautiful. And that's the completed case. Okay. There we have it. So what we've seen here is that my digital philosophy is this, that through digital guided restorative dentistry is the next enabler in our profession. In the same way that surgical implant guides allow surgeons to carry out cases they might otherwise be frightened of, or wary of, okay? Digitally guided restorative dentistry allows the same in our field, all right? Through digital design and templates, you'll have the confidence to take on cases that otherwise you might not. It ensures that complex restorative dentistry can be designed, consented, and executed with simplicity. It ensures that the minimum amount of preparation is delivered in the necessary places to deliver the agreed upon vision. And as a result of an understanding of scanning principles, digital prep design, and modern digitally fabricated materials, you can deliver these results yourself. So you've seen how I've had a digital upgrade, okay? I really embraced these technologies, and they've made me better, all right? So just before we finish, I do have time, and I didn't think I would, to give you a little bit of background on my personal story. So let's do that, because what I want to say is that here I am, having the privilege of lecturing to you guys, all right? But once upon a time, I was in the back of a lecture theatre myself, and only 6 years ago, we didn't have a scanner, etc. So I want to give you a little bit of background to show you where I came from. Okay, so that's my practice. in Yorkshire, and that's what things in Yorkshire look like, nice Yorkshire stone. And we took some time to make it look nice and boutiquey. And this was sort of 10, 15 years ago, where having a dental practice that looked inviting was a modern idea. And we took time to make it look like a bar or a hotel or a restaurant. And this photo graced the cover of the British Dental Journal. And we won some awards, okay, etc. But what I want to tell you is it wasn't always like that. And once upon a time, we're a single surgery NHS practice in Huddersfield. And then I prepared to go private, which meant that we were giving back our government-funded NHS contract to go it alone. But I picked a terrible time to do that. And there were rumors of a global financial crisis on the horizon, and I didn't believe them. I thought, because I'm the eternal optimist, but unfortunately I was wrong. So that put a little spanner in the works, as did me tripping up while holding something. And therefore, what happened next was what I call broke and broken, because I couldn't practice dentistry, global financial crisis, and a terrible time to enter the private revenue. So when our contract finished, our private revenue was only half it was before, and that maths did not add up. So we unfortunately had to make some changes in our personnel, and on one fateful day had to make 6 members of staff redundant. For 2 years after that day, our net annual profit was £4,000, and I just had my firstborn son, Benjamin. So every morning for 2 years, whatever cash we take across the till, we would take to the bank, so that it would limit how many direct debits were not going to go out of our bank. And on many occasions for 2 years, my receptionist would lend me a £10 note to take me above the threshold so that one of our bills would still get paid. And another day, the bankers from NatWest came to see if they should shut us down. So they're the challenges we faced in our career. And if we can do that, then I just want to show where we came from. A little personal video, and then we'll get back and wrap up. I had a business that I didn't believe in, a way of doing dentistry that I felt could be done better. So I tore it down and started again. I built a building that I would want to spend time in, that felt like a home. I built a team that cared about people and who wanted to do things better. And I built a base of patients one by one. The way I cared for them and for their smile encouraged them to tell someone else a little secret about a hidden courtyard where you could have your dentistry done by someone who cared and someone you trusted. I've tried to create an environment where people feel proud to be themselves. When I arrive at work in the morning, walk through the lounge, and consider how hard we worked to create that environment, I feel proud. It's about loyalty, about trust, and about permanency. We are a membership-only practice. This means that our patients pay monthly in advance for checkups, hygiene, and ongoing care. You can't just turn up and buy a checkup, or turn up and buy a filling. That's not how to provide good dentistry. Good dentistry is about regularity. It's about knowing someone's history, their anxieties, their experiences. You can't buy that, and you can't rush that. You can only hope to provide it by saying to someone, this is what we offer, because we have seen it proven to be the best. By saying, I'm the practice owner, and I carry out the checkups on every single one of my patients, and I'm not going anywhere. What does this mean to me? Hopefully you can see this everywhere you look. It's my passion, it's my dream, and it's what drives me. It's what gets me up in the morning to continue to try and do things better. It's more than just a job. It's about creation. Creating a smile, creating trust. Creating a building where people feel safe. And creating new ways of caring for people better. Everything you see at our practice has been carved from nothing. Everything has been carefully considered, and everything has had my input. But yet everything has been moulded by the experiences of the people who walk through our doors. My team, our patients, the story of how we all got to where we are in life. Because most of all, my practice is about the people we treat. I wanted to create an environment where my patients feel they have ownership in my practice. That they are part of this building and they have my expertise at their fingertips. That they have a place to take their family to for their care for the next 30 years. And after that, who knows? Maybe one of my sons will take my place. That's loyalty, that's trust, and that is permanency. Well, thanks for that. Now, let's bring it back in. So, just to wrap up, and then I look forward to your questions. What if something? So it was a few weeks ago, and patients who used to attend, their daughter just suffered trauma at school, just tripped, fell, broke the teeth. So what do we do? You know, how do we assess? How do we plan? You know, one of these things comes out of the blue. Now, once you habit form enough, and once you invest in the concepts, then you shouldn't have to think what to do, because you're going to start with a scan. All right, whatever it is, just start with a scan. So we've got a very little case study that shows what if something happened that's a little bit different. Just do the same workflows, all right, and let digital elevate what you do. So let me show you. So patient presented, she's got some crowding, age 8, if she will. We did have time to discuss Invisalign briefly, but we kept it on point. But obviously the crowdings led to the fact that the upper right 1 and 2 are proclined. So when she fell, they took the brunt of the force. So we're looking at these fractures here, upper right 1 and 2. So she's 8. So, you know, we could do some composite additions, obviously, and it kind of is what we're going to do, but we're going to do it by embracing the concepts you've seen today. Okay, digital design, digital consent, etc. Even on an 8-year-old. All right. So we take some scans, which the patient was absolutely fine with, and I still did record scans on her. And we do this digital design, which shows just a very additive approach. Okay. And if we get up close and personal in a minute, so we're not addressing the rotations because I don't want to do that. We're just replacing what was lost. And that's the girl in question, delighted. So if we look at the tools closely, so then we print a 3D printed model, okay? And guess what? We make a stent, okay? And we have some injection sites for the flowable composite. So on the day of treatment, we're just going to etch and bond, apply the stent, place the injectable composite, the flowable composite into the stent, one tooth at a time, finish one tooth, do the other, okay? So the application will be better, the control will be better, and therefore, you know, even if the patient is nervous or moving around, I'm confident we can deliver a better result through digital. And just little details like this, which I love, all right? So look closely at that digital design, and what you've seen is there's a tiny little extra. So digital design ensures that zero preparation, okay? And so we'll just etch and bond, and that 0.2 millimeter composite of a micro layer is over the entire labial surface. Because whenever we carry out composite bonding on adults, you know, we encourage, I don't like there to be a join because that can then get a ledge. So even on a very, very thin superficial layer, we like composite to cover the whole tooth so that it prevents ledge formation. So even on an 8-year-old child, through the digital design, we've been able to ensure that that's going to be the same, all right? And this prevents the potential of ledging. So in closure, I've shown that we're better through digital. So please, if you're not already doing it, I would encourage you to become part of the digital generation. And I'm going to invite some questions, and I'm going to pop up my contact screens and name drop my digital growth program, where we have over 50 practices in the UK and overseas who tune in once a month for me to really dig down into these concepts in greater detail. Terence, over to you.
Thank you, Dr. Marcus. It was a really, really insightful presentation that you had. We do have questions, but at the meantime, I'm launching a poll. So the poll would be, would you like to embark on this digital dentistry journey with iTero? So this will allow one of our friendly iTero consultants to get in touch with you. So just let us know, and we'll get back to you as soon as we can. So we'll just leave it on for a moment. Okay, so as I consolidate the different questions, we do have quite a number of questions revolving especially on the restorative realm. So let's start with one. I think the question that most of our doctors have, I had about 4 questions regarding this. How was it scanning for a child? Because you will see that the iTero wand is not the smallest. Was it difficult? How was it to scan a child?
Yeah, it's not a challenge at all. I have 4 children. I've scanned all 3 of those before, and this was a child who just had trauma, so she would have had permission to be slightly nervy, but she was good as gold. I've heard occasionally the wand question come up, and I've got a little video on it that answers it. But a big wand is a good thing, So if it's your iPhone we're talking about, we like a big camera, don't we? We like a big lens because it captures more. So most of my scans I can do in very rapid time. We didn't go into my background digitally, but I have used all major systems, and from using those systems, I then moved to iTero and bought our first iTero, and now I've disbanded those and have only iTero as our scanner. And that's not because I work for iTero. That happened first. Yeah. Once that happened, iTero wanted me to speak for them. So that's clear. So no, the wand size is not an issue. It just means that you get clearer, crisper imagery faster because the camera is larger. So no, there's no challenge with that whatsoever. For those of you who don't know, the wand has been designed in such a way to self-reflect the tissues. Also, over and above other scanners, the self-editing on the iTero is second to none. So tongues and lips that do get in the way, fingers, anything like that, are just removed immediately, as opposed to on some other brands where it either causes an issue or you have to delete those aspects.
I see. Cool. And that leads me to one of the other questions. So the other question was, did you explore any other intraoral scanners? I mean, apart from iTero, there are other intraoral scanners in the market. Yeah. So what made you make the decision to go with the iTero?
So, Terence, am I going to name drop the other scanners or not?
Probably we'd like to drop the names of the other scanners, but maybe just share with us what was the main thing that made you make this decision with the iTero.
So yeah, my first scanner ever was not an iTero. My second scanner ever was not an iTero, and then basically some of the reasons were. Without going into too much detail, but there was queues for our scanner. So one of the things you should all know is that whatever scanner you first get will not be your last scanner. That's the first thing, because once you appreciate the benefits it can bring, so will everyone else at your practice, and they will form queues for your scanner. So we had to get another scanner anyway, but then we got a trial period for the iTero, and the Invisalign outcome simulation was incredibly compelling. And then we found other features that alongside were better. The iTero is a better scanner for implant dentistry, and I would say that categorically. It scans soft tissue better. It scans mobile tissue better. There are some other scanners that don't favor that. So there are lots of little advantages. And now, right at the very start of the talk, I talked about an interconnected iTero practice. And that is something that we've only really just realized how beneficial that is, because my treatment coordinator will do a scan on a new patient downstairs, and I can immediately bring it up once it's been processed on my scanner upstairs or on my iTero. So all of this little scan web just means it's the very first point of contact we go to. Even at reception now, I've got the girls at reception have myitero.com on their browser. So if a patient rings up and says, I have a fractured tooth, I say, bring up their scan immediately so you can talk about what tooth it is and treatment plan them remotely. So these are the things that start breathing life into how you live and work.
Wow, sounds really good. So then we have another question, or rather 2 of the questions revolve around scanning of edentulous areas. How's your experience with that?
Yeah.
Because you mentioned soft tissue was not too bad, and we just wanted to find out.
Yeah, you saw the 32-second full arch implant scans, okay? And that is not what our experience was with other scanners. They didn't like pink. And there are other scanners where the forums rightly tell you that you have to draw on the gums for it to be picked up by the scanner. And we indeed did used to have to do that before. So it was one of these accidental discoveries that we found. You know, we bought the iTero primarily to help our Invisalign patients, and then it ends up helping our implant patients, sorry. So yeah, like I say, that's just one of, we carry out a full arch case probably 2 a month, maybe 3 a month. So we've got years of data now, like I said, over 100 cases where you scan the implants, and the first, we make a full arch milled PMMA restoration from that never really touches a human, and it goes in every time, and the occlusion is spot on every time. It's really still mind-blowing, even when we do it today. So yeah, I would definitely advocate the iTero for anyone who carries out implants.
See, but because so one of the questions was talking about in-house lab. So everything is self-controlled within your practice.
Yeah.
So how is it like? Have you ever outsourced your restoration? Has it always been in-house? One of the questions is that, yeah.
Nice question. So no, it evolved. So so initially we'd outsource our 3D printed models before we got so everything's like a evolution, a little business case. So we used to outsource our 3D printed models, and we actually used to mill in-house and then seat it on the model. And then we realized that purely digital wasn't enough aesthetically, so we brought in our ceramist, etc. So and at a certain volume of outsourcing, you go, do you know what, we're going to get a 3D printer. So what I've been finding on our delegates on the other course is their labs tell them they're digital, but they're not. Okay, so what they're doing is they're taking the scan, making a model, and then carrying on analog processes thereafter, and sometimes charging extra for the digital. Okay, and it really shouldn't be, because any large or truly digital lab will tell you that digital should make things more efficient for the laboratory, and therefore it should be able to pass on those cost savings to the patient. Sorry, to the dentist. Whether you pass them on to the patient's up to you. But yes, so do make sure, because the components of a truly digital lab I've shown today: printed models, milled restoration, that's done, okay?
How about inaccuracy? So some of the questions revolved around, could you share a bit if there's been any inaccuracy with scans, with the scans that you have achieved, misfits with restorations, that sort of idea?
Yeah, great question again. So because we've seen both through some of our external customers at the lab and even internally with our associates, you cannot, this is one of my quotes, you cannot just carry out 20th century dentistry and wave a scanner over it. It is different, okay? So retraction cord, in my experience, being one of the things, but there are others, okay? So you may find that restorations that you do digitally have issues, but it's not the scanner. You know, whatever. If you introduce something new to your process, you often blame that thing. Yeah. So if you're going out to the shops and you put blue shoes on instead of red, you might think it was their fault that something happened. Okay, but it's not the blue shoes. All right, and it's not digital. So no, the accuracy is not in question. Okay, because as I showed, the same data is going to the same place. On our implant restorations, once we've fitted our temporary from a scan, I know categorically that the definitive restoration will fit because nothing has changed, okay? The same data has just gone to a different mill. So, you know, it's a mind, you've got to fix the mind that says, no, you know, it's not the new tool, but it is how you use it a little bit, okay? So your preparations need to be smoother because a mill cannot mill a right angle. So you need to make sure that your restorations are smooth. We'd have instances where my associate would fit a restoration and they'd say the margin was too short, and it wasn't. It was just that her prep was too square, and therefore it wasn't sitting from the incisal edge. You with me? So it's little techniques like that that we teach on the course and that are about the detail. But it's normal for humans to blame the new tool, but it isn't really that at all. So the accuracy is simply mathematics, okay? If I can get that one out of the way.
Cool. So maybe we just have some time for another 2 more questions. We won't hold up our participants and yourself for too long. Just 2 more questions. So I think this is a question I always encounter because you said that everything in your practice starts with a scan. So how do you broach the subject with scanning every patient? Do you charge them? That's the question that was written.
No. So we were talking about this again recently. It was around, I think it's around scanning at checkups. You know, scanning at checkups is the last part of our evolution because you have a larger number of easier wins earlier on in the process. So you scan at a consult. First time you scan a consult, you'll see immediately the profound difference it makes to your, conversion and therefore revenue. Okay, so the minute you do that, you go, well, I'm not worrying about the scan tip anymore. All right. Now, further down the line with your checkups, you're going, oh, well, what benefits am I having here? And for me, it's like I say, it's the most comprehensive record you could ever have of your patients. It's that remote treatment planning we just talked about. So it's all these concepts and things that just appear, but each one of those breeds efficiency, and that's where the money comes back. And you can't often see that on a spreadsheet, but it's there. So personally, like I say, as a philosophy, what I do at my practice is I deliver a service, okay? And then they see the value in it and I charge when I deem appropriate. You know what I mean? So it's not, and I don't really give options. It's not like you can have a normal checkup or you can have a digital one and it's £10 more. No, this is the way we do checkups at the Courtyard, okay? This is now the benefits of that. And this is what your monthly membership costs are if it needs to be more for any reason. But so it's always deliver the value first and then tell them the cost thereafter. But yeah, that's the way we do it. But all business models are, up to the practitioner or the clinician, obviously.
I totally agree. And we'll just finish off with the last questions. And for the remaining questions, I'll just engage you separately. So the last question I think is very apt. What's the next step in your digital dentistry?
In mine?
Yes.
Oh, that's a great question. Whoever asked that one. What is it? Well, I mean, the truth is it's continue to do what I'm doing here. And it's pushing more people into the digital generation because then, for many years, I've had to keep many of these discoveries a secret because the audience wasn't ready. You know what I mean? So I'm taking a great deal of joy out of speaking to people who now are ready and who can click the profound difference that scanning some temporaries that are already in the patient and that that are patient tested data, how that is so far improved to 20th century dentistry where it's stone models on a metal hinge, So that's my own personal journey, just continuing to spread the word. And it's really enjoyable when I see dentists then carrying out our workflows and coming back to me and saying how powerful they've been and how simple.
All right. Sounds really, really good. Thank you so much. I hope Dr. Marcus has answered your questions. So if your question hasn't been answered, we'll get in touch with you. And of course, we'll engage Dr. Marcus' expertise in the area and of course, get back to you. So thank you so much, Dr. Marcus, for helping us with today's session. Really, really insightful presentation. And I hope that everybody in this webinar have enjoyed themselves.
Thanks, everyone.
Mm-hmm. Thank you. Bye-bye.